All right, we're going to talk about steri strips and closing a wound with steri strips. First thing I need you to know, if you're going to close a wound with steri strips, I need you to know if it's even an appropriate wound for steri strips. So how do you know? Well, first of all, that wound has to be well approximated. Okay, you're not going to use tape to bring together a wound that's pulled really far apart. This is not the time to try to relieve tension off of a wound, okay? A really deep wound, probably not a good candidate for steri strips. Remember, when we close something, we bring the skin edges together and allow it to heal, but everything beneath there is going to take weeks and weeks to heal, okay? So giving it a little bit more structure with something like sutures on a deep wound might benefit your patient in the long run. So remember, it's got to be a straight wound. It's got to be easily approximated. It can't be too deep. The other thing you have to remember if you're going to use steri strips to close a wound is the wound has to be dry, because you're obviously not going to be able to get steri strips to stick to something that's wet. And then finally, if you got a really hairy dude, steri strips aren't going to stick to that guy either. Okay, you're going to have to use something else. So all of those things, easily approximated, not too deep, the wound is dry, there's not enough or there's not too much hair. What are you going to do? These are your steri strips, right? We can take one piece of tape at a time, one steri strip at a time, and we can close the wound manually, hold that wound together, apply a steri strip. Bring it all the way down. We bring that wound together, apply our steri strip from one side, pull it across the wound, tape it down. You want these to be just a couple millimeters apart. We bring the wound together manually, hold it together, pull, tape it down. So what do you do? What do you counsel your patients to do after you've applied steri strips? Can they get the wound wet? They can get the wound wet. Encourage your patients to shower. We like clean patients, okay? Can they soak the wound for a long time, take baths, do dishes, swim in pools? No. That's going to cause the steri strips to come off. So can the wound get wet? Yes. Can they submerge it for long periods of time? No. Okay. They should let those steri strips peel up and fall off on their own. That you can counsel them that they can trim the edges as they start to peel up. Okay. The last thing I want you to know, I should say two more things. If you've got a patient who has very thin skin and you're afraid that when you put a needle driver and a needle through that skin, the skin will tear, you can actually use steri strips along the long axis of the wound to give that needle something to grab onto and something to kind of hold that knot. That way you're not shredding that thin skin. If you remove a patient's stitches and you're concerned that that wound might dehiss or open a little bit, you can also apply steri strips to close a wound after you've removed the stitches and just give it a few more days or another week or so of approximation. Okay? And that's it. That's steri strips.